Hey guys, Adam here with Anabolicclimbing. If you're new here, we're going to be breaking down various different performance-enhancing drugs and their impacts on rock climbing performance, and we can figure out whether or not it's a thing worth testing or a thing not worth testing. And today we're going to start with the compound I am most excited to test out, and that is Oxandralone, otherwise known as Anavar. So, what is Anavar? Anavar is a DHT derivative that helps gain and retain muscle, lose visceral fat, which is sweet, improve collagen synthesis, that's a big one, as well as improve recovery times for burn victims, tendon tears, and other wounds. So on paper, Anavar seems pretty ideal for climbing. It's used for chronic infection. It's also used alongside potential corticosteroids, helps with preventing bone loss, and it is classified as an anabolic steroid. Like I said, it's a DHT derivative, so it's a synthetic version of an endogenous hormone already made in our body. So, in addition to improving collagen synthesis and improving mineral bone density, it has positive outcomes for injury recovery, in some cases 30% faster, which is dope. The other part that I think is really worth mentioning before we jump into our deep dive is it's not really suppressive to the hypothalamic pituitary axis. So while you will have lower LH, FSH, and slightly suppressed testosterone, you won't be completely shut down. So you may not need to run post-cycle therapy afterwards, but hold on, don't go there yet. Also, it's potentially safe for women. It's been prescribed to women for probably 50 plus years now, but in super low doses. And the reason for that is you don't want women to virilize, otherwise known as developing masculine features. So that could be a deeper voice, more muscle, really impacting sex drive, but one thing at a time. So why is it worth considering? Why am I considering taking Anavar, and why do I think it would be really good climbing specifically? And number one is strength gains. You're going to get an ability to pull hard. Your muscles will both gain better pumps as well as increased strength. You're going to gain weight in some cases up to, I want to say, I think it was 6 to 7 pounds of body weight in about 12 weeks, which is a lot. Very low on the side effects, and also we want to evaluate how likely we are to get injured on it. Because of the collagen synthesis, I think that it's lower on the injury risk side, but we're going to get into that a little bit later. So what are some of the things that I'm looking for? How much harder am I going to be able to pull? Am I going to gain more weight than the amount of weight I'm able to pull? Am I going to destroy something, whether it's a bicep tendon, a pulley, something along those lines as I'm training? And what are the side effects? While Anavar is pretty hair safe, it is kind of rough on the lipids. It's an oral steroid that's more effective when taken sublingually. But, am I going to potentially be more irritable? Is it going to impact my sleep? Am I going to lose my gains when I come off? And, as I'm going to be monitoring my health markers all the way through, I have to decide whether or not this is, if the juice is worth the squeeze. So, how are we going to use it, and how has it been tested? And before we get into the PED context for it, let's talk about what it's been used for medically. And you can use it as low as 2.5 milligrams to 20 milligrams per day over 2 to 4 doses for up to 5 months is how long it's been tested. There are various FDAs that will allow you to run it for up to 3 years continuously, although most of the studies that I've seen kind of cap at 5 months. And it helps with relief for osteoporosis, for pain relief in bones, offset proteins from catabolism, HIV muscle wasting syndrome, Duchenne's or Becker's muscular dystrophy, and it can also help with burn recovery. One of my good friends who I climb with is a nurse, uses oxandrolone all the time in her patients. Turner syndrome, anemia, alcoholic hepatitis, and hypogonadism, which pairs super, super well with growth hormone, but more on that later. So now let's get into the nitty-gritty. Why is this good for climbing? Going into some of the other contexts where it's been deployed athletically, and why I'm leaning more toward oxandrolone than most of the other compounds for being ideal for climbers. So number one is the improved mind-muscle connection. Being able to flow on the wall, and whether in my case, I like to climb big moves on big holds, so being able to jump that much further, grip that much harder once I come down onto the hold, that's really enticing to me, especially as a boulder. It synergizes super well with caffeine, builds quality bones and tendons, improves recovery, helps lose visceral fat, retain muscle in a deficit, and potentially even build new tissue. And it has a 9.4 to 10.5 hour half-life in young adults, up to 12-hour half-life, I think, if you're over 60. So basically, this is going to be in and out of your system super, super fast, which is great as far as feeling the impacts like that, and kind of rough in terms of easy come, easy go. If you are off this for about 6 weeks, you are likely going to lose a lot of the gains that you made on it. So before I give you a little bit of my anecdotal experience with it this week, it was actually part of the Duchess cocktail, which was what the Russians used in Sochi, and I also believe in the 2010 Olympics as well. Right over here to the right, you can see all of the medals and sports that the Russians won in the Summer Olympics of either 2010 or 2012, I don't remember which. And yeah, over 1,000 Russian competitors popped for anabolics, where this was one of the main compounds involved. Again, when I said sublingually, what they would do is they mixed a combination of primobolan, trenbolone, and Anavar sublingually. They swished it around so it went directly into the bloodstream and had a really fast clearance time. Shout out to Gregory Rodchenkov for spilling the beans, and if you haven't seen Icarus, Jesus Christ, go see that movie. It's incredible. So anecdotally, before we go into it, I tested Anavar in 2 sessions so far. One, I wanted to do some light top rope and some bouldering, and another, I just wanted to attempt a project that I only had a couple minutes to do. Unfortunately, my dog's been sick, so I only had about 5 burns on this dyno, but, you know, even with a light warm-up and 5 burns, I already got another inch on my jump, which was awesome, and I was about this close to sticking it. I think it goes next session. When I used it on ropes, the pump wasn't too bad. Granted, I was mostly pretty vertical. I wasn't on anything super overhung. I do think the pump could potentially be a problem if you're doing super overhung stuff, but I'm going to test that later on next week. When I would dyno on this, I just feel more explosive. Being able to just pull really hard, pull through, gaining, you know, an extra 2-3 inches on my vertical or on my dynos means a whole bunch. So I have been incredibly impressed. When I did it on a campus problem as well, I felt lighter. It felt easier. I don't really think there's a question of asking, does Anavar work? Of course it works. It obviously works. The Russians didn't dope with this for no reason. Bodybuilders don't consider it their number one oral for no reason. Anavar is super effective. The question is it the right tool for this job? And, you know, we're going to find out more. So far, I am extraordinarily optimistic on this compound. But not everything is sunshine and rainbows. So let's talk about what are the potential downsides to climbing on Anavar and what we want to avoid. And the first is pumping out. I'm going to try running the torch a little bit later next week, knowing full well I'm going to pump out. And I want to see how bad it is. Is it worse than just pumping out naturally? Is it something that is manageable, or is it really so bad that it kind of ruins my session? And also, is it one of those things where it might gorge so much blood flow that it's actually positive for training. Number 2 is cramps. If you don't warm up properly or you have some electrolyte imbalances, Anavar is known to have some cramping. Again, tolerable for bouldering, really bad for sport. Weight gain. Would me gaining 6 pounds of muscle be useful? If it's in place of 6 pounds of fat, hell yeah, that would be amazing. If it's just in general, then I don't know. So we're going to have to be on our P's and Q's for our diet, but it's definitely something that I am pretty interested in testing out, and I've been monitoring the body comp changes. And lastly, this is a little bit like, and I sort of put it here, your body going into testing PEDs is going to be what your body is going out. It's like adding NOS. If you're a seasoned climber and your body's in shape and you don't have a lot of injuries, it gives you another gear to go. On the other hand, if you're full of injuries and your body's rickety and you're not super well trained, it's like putting NOS on a Toyota Tercel and you're going to rip that thing apart as soon as you really step on the engine. So you have to make sure your tendons are ready prior to doing this, augmenting your training and maybe going a little bit less into raw strength. I'm going to up my rep range from 5x5s to maybe the 10 to 15 range for a little bit of time, just because I don't want to risk a tendon tear while I'm figuring out how I feel on Anavar. It also can be rough on your lipids. Excuse me. So even though it's tolerated pretty well for over 5 months, you do have to monitor your LDL and HDL. And yeah, if you take it sublingually, I haven't had issues with acid reflux. If you just take it orally, people do talk about having pretty bad acid reflux. And as a guy with a sensitive stomach, that happens to me all the time. So sublingually is the way to go for me. Also, if you swish it around with grapefruit juice, I believe it's the citrus bergamot, it helps get in your bloodstream a little bit faster. So, super interesting stuff. And also, like I said earlier, in women, if you go above 5 milligrams, you are asking for virilization. Do not do that unless you really want to look more manly, in which case, live your truth. Far be it from me to tell you no. But definitely a warning to all women, dose this responsibly. And now, to show you guys that I'm not talking out of my butt, we're going to go through PubMed, and I went through this so you don't have to, and we're going to take a look at the anabolic, androgenic, steroid, oxandralone, and the treatment on muscle wasting. We're going to go through Carl Grunfeld's study on AIDS and muscle wasting, as well as the impact on collagen synthesis, as well as Anavar on wound healing and collagen synthesis. So let's jump right into it. Before we do, we're going to get a brief quote from Vigorous Steve's dissection on Anavar, the godfather of steroid research himself, one of the trusted resources that I go to. And even though I've double-checked his work, it's an awesome starting point if you want to learn more about pharmacology. Shout out to Vigorous Steve. So bodybuilders get a better hypertrophy response running Anavar because they get a better contraction and anecdotally a better mind-muscle connection. And there seems to be, and even though there's little scientific evidence to back it up, the contractions whenever you're getting pharmaceutical grade Anavar is pretty insane. If you are cutting, you're going to get harder, denser muscles. You're going to need to be leaner to feel that. And see that, especially as bodybuilders or as rock climbers and not bodybuilders. When we get into the 12, 10, 8% body fat range, we're going to look and feel harder, which is awesome. Improving collagen synthesis is dope. Improving skin, joints, and ligaments, all good things that we want to do. And catabolism and fat storage suppressing catabolism and fat storage through the glucocorticoid receptor is awesome, especially in deep cuts. Vigorous Steve has mentioned that the fat on his lower abs becomes way less and the abs become more visible, which is an awesome cosmetic effect, and we don't need fat. Fat does not let you pull harder. So we can dose between 0.04 to 0.1 milligrams per kilogram of ideal body weight once to twice per day for up to 36 weeks. Single doses of oxandrolone can be 10 milligrams. You can also break your pills, which I am currently doing. I'm running about 5 milligrams per day to assess tolerance and then double checking it against blood work parameters. The high dose, folks have run between 20 to 40 milligrams, 20 milligrams twice a day for 7 days for up to 12 weeks. So going through the first study from Rhonda Orr and Maria Finatron Singh, you're going to find that there were significant raises in HDL and LDL. If you're doing this orally and not sublingually, there will be a disproportionate impact on the liver, which you need to be mindful of and check with blood work. Remember, your liver can recover, your kidneys cannot, so you have to be on your P's and Q's checking that. And even though there were elevated markers, but nothing that raised red flags or for severe damage, it is important that when you get your oxandrolone that you test it, not just to make sure that it's real, but to also check the doses to limit some of the toxicity to the liver. So let's talk about body composition for AIDS and muscle wasting. Folks were basically given either a placebo, 20 milligrams, 40 milligrams, or 80 milligrams of pharmaceutical grade Anavar per day for 12 weeks, and then, or for initially for 2 months, and then for an initial 12 weeks, they were dropped down to 20, 40, or 80 milligrams. In this study, body comps were checked along with LDL, HDL, checking levels of testosterone, LH, and FSH. We're going to go through each of it. But interestingly enough, the body composition was better on 40 milligram groups than the 80 milligram groups, which means there's kind of a top ceiling on this. Also, as we go through other body compositions or body compositional studies, people tend to have better results running less Anavar for longer rather than more Anavar for shorter duration. So although I could take a small amount of Anavar and send my project right now, to get the most out of this compound, running less for longer would probably yield me disproportionately better results. But let's check the data. So, taking a look here, we can see that the 80 milligram group started having lower weight gains, probably because their stomachs were, they were probably having trouble eating. If you're taking 80 milligrams of pharmaceutical grade Anavar, it's pretty difficult to not get irritable, and also the acid reflux was probably pretty rough. So here we could see the 40 milligram group actually gaining more weight. With the 20 milligram group, that might be where we're probably best off. And you could also see that things were continually going in an upward trajectory. You can see the weight gain right here. But I believe folks were gaining between 1.8 kilograms, 1.7 kilograms. Folks were gaining up to 1.8 kilogram of muscle, which is flipping crazy in 12 weeks. Good stuff. And on to the stuff that we are interested in. Impacts on creatinine were disproportionately high, not ideal. We could take a look at the luteinizing hormone, here are ALT numbers as well as glucose. So LDL, HDL, and LPA all were raised slightly, still within the tolerable reference range, even at monstrously high doses. I would never suggest anyone go above 20 milligrams, but still tolerable at higher doses. And before we jump into the next part, going on the gonadal pituitary function, your baseline total testosterone levels were averaged at the lower limits of 270 nanograms per deciliter, which isn't hypogonadal, but like, whoa, you're pretty close. So if you're on, so for example, my natural testosterone ranges between 575 to 830. Me going to 270, I would probably want to hop on TRT or something along those lines. And while it's technically in the reference range, along with the LH and FSH, the oxandrolone did suppress pretty substantially. However, you have to remember that you are getting the DHT derivative from the oxandrolone. And if you're naturally endogenously making about 10 milligrams of hormones per week, or per day, to be taking 20 to 80 milligrams of additional androgens and to not be completely shut down, you're way bigger and capable of muscle growth and strength gains than you otherwise would be without it. So that's definitely a pretty major upside for oxandrolone. Now let's see how badly free testosterone, LDL, and SHBG were impacted. So for the 20 milligram group, the baseline, everybody's free testosterone went up compared to, or total testosterone rather, was higher compared to the baseline. Hold on. SHBG was crushed, but still working. The HPTA signaling was not atrophying, which is awesome. And the same can be said for the LH and FSH. While there are very significant drops, you're still technically within the reference range here, even if you are on the lower end spectrum. I would still recommend using HCG or something along those lines to kickstart the HPTA afterwards. I'm running HCG alongside my Anavar right now, but you could theoretically run an oxandrolone only cycle, even though I think you shouldn't. Again, taking a look at the free tests, SHBG, LH, and FSH. LH and FSH was disproportionately crushed above the 20 milligram threshold. So we're looking at a 30% increased crushing on the 40 milligrams and twice as much suppression on 80 milligrams versus 20, which probably means we're better off in the lower range of the drug exposure. But the last thing I really want to talk about is oxandrolone and its impact on collagen synthesis, because this is one of the things that gave me pause and a phenomenon that I want to explore a little bit more, not just now in my research, but also in future videos. So to determine the effect of oxandrolone on additional markers for osteoblast and osteoblast cultures were treated with and without oxandrolone. Basically, they were using this in, I want to say, in vitro cells, and they exposed these cells to oxandrolone. And initially, there were massive increases, about 21 to 35%, in collagen synthesis, which is dope. But, and this is crucial, when they continued the exposure for multiple days, there was actually a downregulation in collagen synthesis. Now, I think reasonable people can assume that because these are in vitro cells and they're not exposed to any sort of damage or burn or recovery that you would want from exercise, the downregulation is real. So I actually want to read some of the stuff from the other studies to go into it and then make some conclusions on after that. So, showing that oxandrolone administration increases lean body mass for 3 to 6 months before the increased bone mineral density can be observed, which is awesome. That means staying on oxandrolone for a few months is a good idea. Definitely potentially protective for bone and tendon health, which is amazing. The applicability of our findings to the study of the in vivo effects through oxandrolone in burn children is not clear. While the in vitro environment may not adequately reproduce the in vivo situation, many potential variables were eliminated during the in vitro studies, and it's possible to investigate the specific effects of the drug on the cell. Therefore, results may not be strictly comparable. Although the study demonstrates that oxandrolone is capable of affecting the osteoblast AR, androgen receptor, and stimulating type 1 collagen synthesis, which is the type of collagen synthesis that impacts bones and tendons, which is what we're looking for, type 1, the regulatory mechanisms that are present or only in a complex of in vivo situations may account for increased collagen synthesis turnover or degradation after synthesis. So the question is, will the tendons continue to be stronger after they are used? For example, in Winstrol, you do have improved collagen synthesis, but the quality of the lattice structure of the tendon is actually weaker. I don't think that is the case in oxandrolone, and we're going to get into that a little bit later. But yeah, moreover, the delay and increase in total bone mineral content reported in the clinical study may be explained by part by the acute inhibition of bone formation. After severe burns, as previously reported, there may be a lack of osteoblast, and therefore the androgen receptor is able to mediate the response to the oxandrolone. In conclusion, high doses of oxandrolone results in increased nuclear fluorescence of the osteoblast's androgenic receptor, increased osteoblast differentiation markers in cultured osteoblasts, and decreased in bone markers in cultured osteocyte-like cells in vitro. Oxandrolone may have the ability to directly stimulate bone collagen synthesis over and above its effective skeletal loading and increase lean body mass following a long-term treatment. However, longer exposure may no longer be directly anabolic in mature bone cells. This observation may help to explain the variability and confusion regarding the androgen actions on the skeleton. Going into Anavar and wound healing. Basically they were able to, so for this study, I believe they were able to improve heal times by about 30%. Yep. Treatment of, this was an interesting one that was also worth going into. Treatments with oxandrolone and the durability effects of older men. They gave older men oxandrolone and then tested their luteinizing hormone, which again went down. That's predictable. They also gave them between 20, 40, and 80 milligrams of oxandrolone. Again, it's crazy to do that for dudes over 60. And then they measured their lifts because that's awesome. And lower doses, higher yield duration, yielded similar weight gain to higher doses and lower duration with better blood work parameters. So dose makes the poison. Doing this at a lower dose is going to yield better results, and also we'll be able to stay on it longer and climb on it longer and gain better muscle quality for extended periods of time. All groups received 20 milligrams of oxandrolone during the 12-week open label phase and continued to gain weight. At the end, by the end of the open label phase, there were no significant differences in weight gain among the groups, so easy come, easy go. Basically, folks that were on oxandrolone gained weight. Then when they came off 6 weeks later, they lost most of their gains, and that's also shown in some of their lifts, which we're going to get to momentarily. These gentlemen, at 20 milligrams, they gained 2 kilograms over 12 weeks, 3 kilograms on the 40 milligram dose, and 2.5 kilograms over the 80 milligram dose. LDL markers and AST were way better again on the 20 milligram dose. Going through the exercise, leg press increased dramatically, or basically all of their lifts went up between about 9 to 12%. between 7 to 9% between chest press, lat pull down, leg flexion, and leg press. But everything went down back to baseline after 12 weeks of discontinuing the Anavar, which you guys can take a look at here. So at this point, it's been about 30 minutes. You guys have gone over 5 different studies, a lot of my thoughts. Let's try to synthesize it. So guys, with proper diet and supplementation, it's not unreasonable to run low-dose Anavar for even beyond 5 months. You can run this for as long as your blood work will tolerate. If you can handle 5 milligrams on Anavar for the next 1, 2, 3 years, you can run it. You have to just make sure that you're on top of your blood work, either monthly or quarterly, and making sure that your health parameters are good. When you come off, you will lose your gains. If you have something like a testosterone base that you're running, you're probably not going to lose nearly as much. But the half-life is super short. The stuff's going to clear out of your system within a week, and you're going to go back to feeling like a mortal, normal person again. Once you decide to make the decision to go on PEDs, for the love of God, make sure that you're deploying your ancillaries for better blood work, and you're handling your supplementation, your water, your electrolytes, your diet is good, you're doing your fasted cardio. The healthier you are and the more you respect this, the longer the duration you're going to be able to do Anavar for, and the more you're going to get out of the compound. One of the things that I'm trying to be super mindful of as I'm deploying this is to ramp slowly. Could I just slam 20 milligrams a day and assume that I'm fine? Yeah, sure I could. But I also have a wife and doggo and job and other things that need to be attended to. So ramping up slowly, making sure I don't get too irritable, seeing how I tolerate it, seeing how my body performs in the gym and on the wall matters the most. And just trying hard because I feel good could potentially be a shortcut to injury. That's why I'm being even more mindful on fingerboarding and things along those lines. As you start PEDs, be mindful of your injuries. You could very easily hurt yourself, and the last thing you want to do is be so strong that you destroy something because you weren't ramped up properly in the first place. Also, as you go through your compound selection, like I said, could I start popping a bunch more Anavar? Sure, but my goal isn't to gain a bajillion pounds right now. My goal is to optimize performance-enhancing drugs on the long term for climbing and testing them. So just jumping into bodybuilding doses because theoretically I could tolerate it is not something I'm interested in. I'd much rather ramp up slowly and know, okay, I tolerate 10 milligrams per day well, or maybe 20 milligrams per day well, but I'm going to let my blood work, my sleep, my mood, and my training dictate that, and not me chasing some arbitrary person's suggested dosages on the internet. That makes no sense. And I also want to report back on the pumps and the side effects and everything else. In theory, this is kind of the ideal gold standard for drugs for climbers, but we don't know that yet. I still am willing to bet this is going to be the best anabolic I try for the long term for climbing health, but we don't have any data. I am positive that I will meet a climber that is also on oxandrolone, but I haven't met them yet. And until I have data from literally anyone else, I'm the guinea pig, friends. So I'm going to be testing this for as long as I can until my blood work doesn't allow it. Anyway, if for whatever reason you made it to 34 minutes into this video, please like and subscribe. Feel free to share. If you have any questions, please leave them down below. All the comments help the algorithm. And yeah, this is Adam with Anabolicclimbing. I will be testing this on bouldering, sport climbing, and also some speed climbing. Wish me luck, and yeah, so far so good. Cheers, friends.